Mechanism of Pralidoxime, cholinesterase inhibitor. Pralidoxime, also known as 2-PAM, is a medication used to treat poisoning by organophosphates, such as certain pesticides and nerve agents. Organophosphates inhibit acetylcholinesterase, an enzyme that breaks down the neurotransmitter acetylcholine. Pralidoxime helps restore the function of this enzyme, preventing the toxic effects of acetylcholine buildup. Mechanism of action of Pralidoxime. 1. Reactivation of acetylcholinesterase. Organophosphates irreversibly bind to acetylcholinesterase, forming a phosphorylated enzyme complex, which inhibits its normal function of breaking down acetylcholine. This causes an accumulation of acetylcholine and cholinergic synapses, leading to overstimulation of muscarinic, nicotinic, and central nervous system (CNS) receptors. Pralidoxime works by binding to the phosphorylated acetylcholinesterase and removing the phosphate group, dephosphorylation. This restores the enzyme's ability to hydrolyze acetylcholine, reducing the toxic buildup of acetylcholine in the synapse. 2. Time-dependent effect. The effectiveness of Pralidoxime depends on when it is administered. If given early, it can successfully reverse the phosphorylation of acetylcholinesterase before the organophosphate enzyme complex ages, a process where the enzyme organophosphate bond becomes irreversible. Once aging occurs, Pralidoxime is no longer effective in reactivating acetylcholinesterase. 3. Nicotinic receptor effects. By reactivating acetylcholinesterase, Pralidoxime also helps relieve the overstimulation of nicotinic receptors, which can cause muscle weakness, fasciculations, and paralysis, especially respiratory muscles. This is crucial for reversing neuromuscular blockade and improving respiratory function in organophosphate poisoning. 4. Prevention of acetylcholine accumulation. By restoring acetylcholinesterase function, Pralidoxime helps reduce the excessive activation of cholinergic receptors that leads to symptoms like muscle twitching, excessive salivation, miosis, pupil constriction, bronchuria, bradycardia, and convulsions. Disclaimer: this channel does not promote or encourage any illegal activities, and all contents provided by this channel are meant for educational purposes only. Any copyrighted material on these slides is included as fair use for educational purposes only. It will be removed at the request of copyright owners.